We are live.
Hey guys, welcome back to another Q&A session. I think it's been a couple of weeks since we've done our last one. Apologies, obviously busy, and then also holidays, but we're back. So we're ready to take your questions.
Yes.
We love doing these.
Thank you. Okay, so to start off, Stacy B would like to know, what type of hernia repairs do you do?
We do a lot of different types of hernia repairs. So they have a lot of different names. So ventral hernia is a hernia in the center of your abdomen. Umbilical hernia is a hernia in your umbilicus or belly button. Inguinal hernias is in your groin, so you can have on either the left or the right. There's also femoral hernias, which are below the inguinal hernias, kind of a little bit on the bottom part of your thigh, or in the top portion of your thigh below your inguinal ligament. So those are the main types of hernias. One of the hernias that we don't do, but sometimes people think we do, is called hiatal hernia. A hiatal hernia is actually opening in your diaphragm. So it's actually when your stomach wants to get pushed up into your chest cavity through your diaphragm. So that's more of a chest intra-abdominal component. So we don't do that one because usually it's done by laparoscopic surgery by the thoracic surgeon or by the general surgeon.
How do you repair hernias with no mesh? Like, what do you do differently?
Yeah, so most hernias are not a deficit of tissue, meaning there's no missing tissue. So if there's no missing tissue, obviously the tissues are right there and you can use them to reapproximate. You just have to figure out where the weakness is, what orientation the weakness is, and then what the surrounding structures are. So not every hernia gets fixed the same way. So you have to assess all those things and then make a plan for it. It's the equivalent of like maybe construction. So if you look at somebody's wall or floor, you don't repair a problem in their wall or floor the same way, you assess it. Where is the weakness? Where is the strength? How do I bridge these things together?
Perfect. Adita would like to know, I have a kidney disease. It is currently about 20% functioning. Will that create issues with the plus size tummy tuck?
Not necessarily. We'd want a clearance from your nephrologist. I've actually operated on a person that only had one kidney, and then that kidney only was partially working. And we did a huge case. We did a abdominoplasty, a complicated multi hernia repair, and so they did just fine. I think you should be fine. Obviously, we want your blessing from your nephrologist, but we don't do anything to stress you out during surgery for kidney function. We give you lots of fluid in the operating room, so that basically keeps your kidneys working great. Dehydration is a big problem with kidney function that's lowered.
Michelle R. would like to know, why don't you have a BMI limit?
Well, so what is a BMI? A BMI is body mass index, and then it's calculated by two numbers, height and weight. So that doesn't really say anything about your health status or your ability to undergo surgery successfully. So you can take, let's say, a very short bodybuilder, right? So let's say a 5'5" bodybuilder that weighs 250 pounds. They're all muscle, they have like 3% body fat. They're technically morbidly obese because their BMI is so high. But are they really obese? No. Are they unhealthy? No. So the BMI doesn't really communicate enough. The other component is over the last 15 years of being in practice, we've slowly pushed the boundaries of how we do things. Tummy tucks, big complicated abdominal contouring surgeries. And so as we've done so, we also modified how we do the surgery for safety and hydration. And so we've gotten to where we've gotten 15 years later by doing those incremental changes. You can't just graduate from residency with limited knowledge and just start doing very complicated plus-size tummy tucks. It just takes that 15 years or so process of learning how to do all those slight modifications.
Gote Morales would like to know, how long do I have to wait after a baby to get a tummy tuck?
Well, you'd want to wait until at least two things happen. One, you're in a good place in your life, right? So whether you have a partner or a husband, the family situation, all that stuff, but also the baby, what the baby needs, and what your social support system is for having surgery and having a baby. So that's the one box. The other box is you want to wait until your body is a little bit more stable. So if if your abdominal wall and your body is still kind of changing after having the baby, then you don't want to have surgery then because you're kind of hitting a moving target. So you want to wait a little bit of time. So that might be 3 months, that might be 6 months, that might be a year. There's no rush into it. You're just going to get a better and better result the more stable your process is.
Shika323 would like to know, Is a burning sensation normal after getting liposuction?
It can be. When you do liposuction, you're moving this cannula back and forth, and as you're moving that cannula back and forth, you get close to, or you even hit small little nerves that are within the fat tissue. So they get bruised and irritated, and then that recuperation and recovery of the nerves create these little burning sensation and itching and soreness. It's just a normal process. Now, if you have redness to indicate like an infection or something like that, then obviously that might be something different. But otherwise, if everything looks good, that's normal. And just a quick question for Gabby. Is the sun okay on the camera?
Yeah, you look good.
Okay, good. I see a
glowing.
big band of sun on it, so good.
Miss Daisy 8 would like to know, how do you determine if a fleur-de-lis or an extended tummy tuck is normal?
Well, so you have to look at where the loose skin is, and you have to start with that. So obviously most people have a lot of loose skin in an up and down direction. It overlaps their pubic area, and so you know that there's going to have to be a horizontal incision to reduce the skin in that direction. That's very apparent for almost everyone. What's not very apparent sometimes is as you make the waist narrower, is there going to be a bunch of loose skin in this direction, which means that you require to close the skin this way, so you need a vertical. So sometimes it's very easy to tell that they also need a fleur-de-lis. Sometimes you don't know until at the end of your surgery that you need to add that fleur-de-lis, and I always add it at the end.
Right. Flawless Faces by Dominique would like to know, what labs are required prior to surgery?
Well, it depends on what kind of surgery you're having, and then if you have any health issues. So, for example, let's say you're 25 years old and you're getting a breast augmentation. Well, don't really need many labs. You want to make sure you're not pregnant, so you can do a pregnancy test in the surgery center the morning of, just to make sure you're not pregnant, and so you're otherwise good to go. Now, if you have, some questionable sugar control, like pre-diabetes, you want to obviously get electrolyte panel to make sure that your blood sugar is in good control. And then if you have had maybe pre-diabetes or some other kind of issues for a long time, then when we do that, we also look at renal function and blood counts and things of that nature. So a lot of that depends on your health, what you're doing, a little bit of your age, because once you get past a certain age, you get more labs just to make sure. So it varies, but oftentimes if you're healthy and below a certain age, there's not much that's really needed.
Brooke 143 would like to know, how long do you recommend someone to be off work after a tummy tuck? I'm trying to plan ahead.
Well, a minimum of 2 weeks, and that's a bare minimum. And the reason I say that is it takes at least 2 weeks for you to really focus 100% on your recovery, meaning drinking lots of water, really staying hydrated, and letting your body kind of catch up. That's bare minimum. Don't do anything. Don't go to work, don't run errands, don't take care of family. That 2 weeks should be 100% focused on your recovery. Beyond that, it'd be great to have another week or two if you can. So if you have the luxury of doing so, then have another week or two. If you don't have the luxury, then obviously do the least amount of things possible and focus as much on your recovery as possible.
Natalie would like to know, I would like to do a bra line back lift and a breast lift. When should I do first, or would you recommend doing them at the same time?
It can vary, but I usually recommend doing them at the same time because the bra line back lift connects with the breast lift. So the bra line back lift allows me to do the breast lift stronger. The breast lift allows me to take out more skin with the bra line back lift. So they kind of help each other out. So I usually recommend doing them at the same time.
Tris would like to know, will excess visceral fat affect the outcome of a plus-size tummy tuck?
Well, visceral fat is fat deep to the muscle, right? So you have skin, a layer of fat, muscle, and then organs. So the fat that's on the organs is visceral fat. It's also called intra-abdominal fat, also called organ fat. So it has a lot of different names. But basically, we can't do anything about that fat. I can't liposuction it because your organs are there. So yes, it might impact it. So if you have a lot of that, I might not be able to make your abdomen totally flat. That's okay. As you reduce your intra-abdominal fat after surgery, that roundness will get better.
How do you get visceral fat?
Well, everyone's a little bit different. Some people have very narrow rib cage. Some people have very narrow pelvic cage, and therefore the organs are just kind of jammed up in there. It sticks out a little bit. But visceral fat tends to be deposited when you eat things that are absorbed quickly through your GI tract. So it goes into your stomach, and as soon as it exits your stomach, if it's very simple nutrition, it gets absorbed quickly because it's already simple, and it gets stored primarily as intra-abdominal fat, so sugar, alcohol, processed foods.
How long is the average surgery for a plus-size tummy tuck?
About 4 hours. It depends a lot on the patient though. Some patients are bigger and they need more lipo. Some patients are a little bit maybe smaller, or their rib cage is different, or they're a little shorter, so there's a little bit less work, but somewhere in that 4 hour range, plus or minus.
Alexis would like to know, how long have you been in practice?
I have been in practice in Arizona for 15 years. I've came here and I set up my practice here in Arizona in Scottsdale. Before that, I did 2 fellowships, and then so before that, I was in residency. So I've been in private practice here in Arizona for 15 years.
Favi would like to know, how long is the recovery for a BBL?
Well, it depends on where we get the fat from. So ironically, the skinnier you are, the more liposuction that we have to do, the more areas, maybe even around the waist. And it's a liposuction that results in more downtime because you're more sore, maybe a little bit more fluid drainage. So if it depends on where you're getting that fat from. So if you're liposuctioning that fat from the lower back because you have sufficient there, maybe just a week. If you're really liposuctioning things aggressively, then maybe 2 weeks. Working out, I still recommend 6 weeks before you start working out. But time off of work, a week to 2 weeks.
Charles would like to know, can you do a plus size tummy tuck, lipo 360, and fat transfer all at the same time?
You can. We do that quite often, absolutely. I include liposuction with my tummy tucks. So then we would get plus size tummy tuck liposuction to the back, because then there would be liposuction 360 and then BBL.
NYZ would like to know, I had a VSG and would like to know when I can get plastic surgery done.
There's no limitations from my standpoint. You can get plastic surgery whenever you'd like. If you're losing weight rapidly still, then it makes sense just to wait until it plateaus off a little bit. You don't have to rock bottom, because sometimes you have a lot of your loose skin already there, like in your abdomen, and then the last 5, 10, 15 pounds doesn't make that much of a difference. But if you're dropping weight a lot because of the VSG, then maybe wait until it starts slowing down a little bit.
Danny would like to know, should you lose weight before or after getting a tummy tuck?
You can do either or both. You can lose weight before, you can lose weight after, or you can lose weight before and after. It doesn't make that much of a difference, with the exception of the intra-abdominal fat. Remember, if you have a lot of intra-abdominal fat, I can't do anything about that. So if you're trying to get the flattest abdomen that you can have, then the intra-abdominal fat is one of the things that you'll want to work on. You could do that before or after by decreasing the amount of processed foods that you eat.
Jordan K would like to know, what is the difference between a breast augmentation and breast reconstruction after a mastectomy?
Yeah, they can be very similar, basically putting in an implant, for example. But a breast augmentation usually denotes someone who has had no problems with their breast. You're simply putting an implant in there, sometimes fat transfer, but you're basically adding volume to an otherwise normal breast. Breast reconstruction after mastectomy involves rebuilding the breast after tissue was removed during a cancer kind of surgery. And it can still involve an implant, it could still involve fat transfer. Things might be a little different here and there. But usually a breast reconstruction, the gland has been taken out, so you have to do a little bit more work in there to protect the implant and to really build up the foundation of the breast mound.
Erica Dialba would like to know, can we remove my implants and add my lipofat instead of the implant?
Yep, we do that all the time. Now, if your implants are very large, just know that you might not be able to replenish the size of the implant volume in one fat grafting session. For example, you have 500 cc implants, you might not be able to get 500 cc's of fat placed and survive in one fat grafting session. You might have to do 2, maybe 3 sessions.
Abby H would like to know, does rhinoplasty help with breathing issues?
Rhinoplasty is shaping of the nose. Now, it all depends on what you do in there. So I always try to do a couple of different things in the nasal valve area to try to augment the breathing component. But you have to define where the breathing issues are coming from, because that might require the septum or the internal portions of the nose to also be fixed. And you can do those at the same time.
Juicy Vaughn would like to know, is it safe to undergo surgery if you have obstructive sleep apnea?
You can, as long as that's controlled, right? So during surgery, it's not a problem because Dr. Link or anesthesiology is managing the oxygenation and breathing part. After surgery, you'll want to use whatever you're using now at home. So if you're using a CPAP, you want to do that as well afterwards.
Sarah F. would like to know, what is the difference between a tummy tuck with drains and a drainless one?
Well, either having drains or not having drains. That's a simple answer. However, internally, and I know that's not what your true question is, what you're really trying to get at is what happens on the inside between one and the other. So it could be, it might not be any difference, right? So I put what they call quilting sutures in the operating room as well, but I still like to put a drain in there. There's actually a recent article that just came out that they show that the quilting sutures still doesn't decrease the incidence of seroma, which is collection of healing fluid. It just sequesters it out in different pockets. So the body still creates that healing fluid, and it still is there. It just doesn't create one big pool of healing fluid.
The ladies' room would like to know, do you enjoy doing plus-size tummy tucks?
I do. I enjoy challenging surgeries that I get a chance to learn and push the envelope and further the learning process. To me, doing just the same steps that everyone else is doing is just a regular job, and there's nothing wrong with just a regular job. But if there's an opportunity there for me to also learn and create something like, hey, I've never done X, Y, and Z, so let me see if I can figure it out and make it better and better. And that's rewarding for me as well. And so with the plus size tummy tuck, we've been doing that for 15 years, and I still think I'm doing a better job now than I was a year ago. And I'm hoping that a year from now, I'm doing a better job than I am doing now.
Chara would like to know, what do you use for pain management after a tummy tuck?
Well, in the operating room, we use short-acting and long-acting numbing medication. That's included in there. After surgery, we use a variety of narcotic and non-narcotic medication. And we customize that based on what your needs are, your proclivities, allergies, kind of things of that nature.
Amelia would like to know, what is the highest BMI you've ever worked on?
Definitely in the 50s. I know we've done a 54. We might have done a 58 recently, I believe. So we're there. I don't know if we've ever done a BMI of 60. We've definitely done more than a handful of BMIs in the 50s.
What makes someone a plus-size patient?
Well, as much as I don't like just a generic version of the BMI, that is helpful in delineating plus size versus non-plus size. You have to use some type of word, and you have to define some type of category. So usually BMI of, like, let's say 35 and higher tends to be more plus size, and that means I have to start changing the way the tummy tuck is done. If you do a traditional tummy tuck on a plus size patient, the higher their BMI and fat layer is, the more problems you'll have with healing. You have to modify how you're doing it. So that's where you have to start doing a plus size tummy tuck.
Mama G would like to know, can you still breastfeed with the breast augmentation?
You can. There shouldn't be any problems. You have to remember that whether you put the implant on top of the muscle or underneath the muscle, it's still not interacting with the breast gland. So your breast gland is still unencumbered, still functioning, so it should be fine.
Justin would like to know, can you perform a male BBL?
I can, and I have done so. And so, you have to define what that is. Because there is a masculine male BBL, but there's also I guess I would say feminine male BBL. And those are just words to describe the contour of the waist and the buttock area. I'm here to provide whatever shape and contour people desire. And then so I just customize that with each patient.
Bella Divine would like to know, I have type 2 diabetes. Can I still get a tummy tuck?
Yeah, we do a lot of type 2 diabetes. It has to be controlled, right? So uncontrolled diabetes, where your sugars are all over the place, not super great because it's impacted during anesthesia and a little bit after surgery as well. But as long as your hemoglobin A1C is controlled, as long as your glucoses are controlled, either with medications, diet and exercise, or insulin, then we should be good. We've done a handful of people with just full-on insulin diabetes, but they were well controlled and they did just fine.
Martinez would like to know, can you do liposuction to the upper abdomen area?
Absolutely. There's no reason not to. In fact, we always do.
Lucy J would like to know, why do some patients' pubic areas look flatter than others? What determines this?
Yeah, so I always liposuction the pubic area when we do a tummy tuck. I also lift it when we do a tummy tuck. However, some people's pubic area have a lot more connective tissue, so when you're doing liposuction, you're removing fat. But if there's a lot of connective tissue in there, that doesn't really come out. So that's one of the things that can thicken the pubic area. The other component is the architecture of the pelvic bone. So if your pelvic bone is flat and then the pelvic ring sticks out more, then you'll have more flatness there. If your pubic bone is more angled and a little further out, then your pelvic ring, then it's going to stick out a little bit more. And obviously there are some things we can't control, such as those two items.
Ashia, so incredible, would like to know, I weigh 325 pounds. How much weight do I need to lose for a plus size tummy tuck?
Well, I don't have a weight or BMI restriction, right? So if we can do a plus size tummy tuck, get a great result and do so safely, then I'm happy to do so at whatever. The flip side of that is you can lose whatever amount of weight you want and you can have the surgery at whatever time you want. So the key to that is not to do anything artificial, meaning you should impact things in your activity and impact things into your diet that result in a better lifestyle, more healthy living, and then subsequent weight loss. And it should be sustainable, and it should not be kind of a crash diet kind of thing. And then you can do that, and you can choose to wait until you've lost a lot of weight, or wait until you lose a little bit of weight, and however it works for you.
T. Ham would like to know, how long after a C-section would I need to wait for surgery?
We had another question earlier on about how long you should wait after having a baby to have surgery. And the C-section is really part of the same question. You want to make sure that your family situation is set up, and then you want to make sure your body is still not rapidly changing status post your pregnancy delivery. And so as long as those two things are taken care of, you're good to go.
Nasha Manya would like to know, how many procedures can you get done at once?
Well, I tend to kind of limit my surgery on any one person to probably about 10 hours. We've periodically gone beyond that, but most times it's between 8 to 10 hours max on the right patient, right? And so you can get as many procedures as you want, as you can fit it in there. Some people just have 2 procedures that take 10 hours. They're just really complicated, right? And other people are very small, and so we've done breast lift, breast augmentation, back lift, arm lift, tummy tuck, thigh lift. We've done 6 on one patient. They did great. They're out of Texas, I believe. No, Texas. And so they did great. I think surgery took like 10 or 11 hours. But we customize that for each patient.
Ren would like to know, is a fat transfer to the breast or implants a wiser choice?
They have advantages and disadvantages. They both do, right? So an implant could give you more volume in one surgery than a fat transfer can. An implant is going to be a little bit heavier than fat transfer, and it's not going to necessarily change with your body's changing. So with an implant, you might have to replace the implant periodically. There could be implant shifting around, things of that nature. There could be a capsule contraction. Fat transfer, on the other hand, you have to take it from somewhere, so there's a little bit of recovery from where you take it from. You can't go as big in one fat grafting session as an implant is, and you don't get that super round firmness that some people like with the implant. Then again, you also don't get that super round firmness that some people don't like with the implant.
Jody Rodriguez would like to know, implants above or below the muscle, what is the difference?
If you're super thin, consider putting the implant underneath the muscle, because the muscle adds one more layer of thickness. If you have a lot of breast tissue and you're getting a reasonably sized implant, consider getting the implant on top of the muscle, like in a subfascial position, because there's not a lot of advantages to going underneath the muscle. Recovery is quicker, the implant looks better, so that's what I would do. Beyond that, there's not a lot of differences.
Can you only change the tip of the nose with rhinoplasty?
You can do it with a non-surgical rhinoplasty by injecting fillers, but if your nose is very wide, you can't really change that much with a non-surgical rhinoplasty. You can primarily just add projection to it, and that sometimes makes it look a little narrower, but it doesn't actually make it narrower. So those are the 2 ways of fixing nose shapes in general. Non-surgical by injecting filler, then surgical rhinoplasty by adding and subtracting cartilage.
AZ Spoon Mom would like to know, is liposuction done differently if it is being used in a fat transfer?
It should be done. So you should be changing the amount of suction on the cannula. You should be managing how big the cannula is, and then the fat obviously goes into a sterile container on the sterile part of the table, as opposed to in a non-sterile canister. So there are some changes. Then you should consider also how you prepare the fat before you liposuction it, and then also you prepare the fat before you inject it.
Okay, Cherry would like to know, is medical residency like Grey's Anatomy?
It's been a long time since I watched that movie. I guess there's probably going to be some truth to it, But you know what's interesting? Everyone looks so fancy in Grey's Anatomy. Like, yeah, everyone looks all fancy in there. Yeah, I guess it depends on where you're going. When I was doing medical residency, which was 16 years ago, I know I really liked it. I liked it. It's a lot of work, and it should be a lot of work. You have to remember you have 5 or 6 years. Now it's 6 years. It used to be 5 or 6, but now it's just 6 years. You have that amount of time to learn as much as you possibly can. And just because you graduate, that doesn't mean that you're good or you've done something great. It just means that you've passed the bare minimum. So if you really, that's your opportunity to learn. So it's a long slog. It's 5 to 6 years of really pretty much around the clock studying and work. If you're really trying to squeeze out as much as you want at residency. With regards to the non-learning part, there are some shenanigans in residency because there's people that are tired and they're locked up in the hospital the whole time, and so there is some, I guess, social activities that occur similar to Grey's Anatomy. But obviously, Grey's Anatomy just seems way too fancy. So I think that's the biggest thing. Everything's all gleaming and nice and in these big rooms everywhere. I'm like, that's not how it is. So it's get to work. That's kind of the basic idea of residency.
Okay. Jocelyn Snyder would like to know, do you have any advice for someone considering their first procedure?
Well, obviously prioritize. Focus on what you really are trying to accomplish. You always have to come to plastic surgery with a sense of self-worth, right? So you need to feel good about yourself and have a good sense of self-worth regardless of anything else in the world, right? Regardless of how you look, who you are, where you're at, etc. That's your core. And then if you're trying to improve things about how you look, you have to define what that is and why you're doing it and what you're trying to accomplish. It has to dovetail nicely into your overall life. And that's how I would start it. I would not look at it from a negative standpoint. I would look at it from a positive standpoint.
Genevieve would like to know where you're from and what your accent is.
Oh, I'm from Romania. So Romania is in Eastern Europe. It butts up against Ukraine and Moldova. So it's kind of right up in that area where they're having all this action at. So that's where I'm from. I was 8 when I moved to Los Angeles with my parents and my sister from Romania. And then so that's where my accent's from.
I don't think you have an accent.
I didn't think so either, but I think both I and everyone else that speaks with me just gets used to it. So the fact that other people can tell, probably they notice it because they haven't really listened to me too much.
Yeah. Kimberly would like to know, how long after a breast lift and augmentation do I need to wait to go back to work? I am an EMT.
Can you repeat that question, Gabby?
Yeah. So she would like to know, how long after getting a breast lift and a breast augmentation would she need to wait to go back to work? She's an EMT.
Got it. So EMT, obviously, you gotta haul some stuff, maybe pick the patient up, gurney in and out of the ambulance, all that stuff. It's quite a bit of stuff in there. If you're getting the implant on top of the muscle, it's going to be a little quicker because the muscle is not part of that. I would take probably 2 weeks off of work if you're getting a breast lift and a breast augmentation, minimum. Probably longer. Now, if your EMT position allows you to do some restricted work, then maybe take 2 weeks off of regular and then another week or 2 of restricted work where you're maybe not in the field. But the EMTs, there's potentially a physical work. You're out there hustling.
Miss Emmy would like to know, can you lipo back fat or can you only do a bra line back lift?
You can do both. Liposuction reduces fat. A lift of some sort, like a back lift, also reduces skin. So you have to define which is the most common one. And of course, if you're doing a bra line back lift, then you can also do lipo in addition to that.
Natalie would like to know, with the breast lift, will I lose a breast size?
A breast lift doesn't reduce breast tissue whatsoever. It shouldn't. So you can get a breast lift and you should be the same size, volume-wise. Now, you might be wearing a bra cup size that's not ideal for you. For example, when a breast is a little bit lower down on your chest, you might be wearing a cup size in your bra that's accommodating a breast that's malpositioned, but the volume is not appropriate for that cup size. So you might be wearing a D cup, but you're really a C cup. So when you do a breast lift, your bra size decreases or might decrease, but your actual volume is the same.
Letitia would like to know, does it make sense to get a BBL with a plus size tummy tuck if you plan to lose weight after your surgery?
You still can. You have to figure out how much weight you want to lose, and you have to figure out where that weight's going to come from. Remember, fat cells remember where they used to be. So when you lose weight, if you primarily lose weight, let's say from your arms and legs, and your tummy stays full, then if you're taking that fat and put it in the buttock area, then your fat cells will actually stay full even though you've lost some weight.
Hannah H. would like to know, how long after a gastric bypass should you wait for a tummy tuck?
It depends on how you're doing with your weight loss. Remember, I don't have a weight or a BMI restriction. Ideally, we wouldn't want to be doing surgery as you're losing weight rapidly because we're hitting a moving target. We'd want to wait until you plateau to a certain extent, maybe not even plateau, but just slow down enough so you can get a good representation. Okay, this is kind of how I'm going to look. Obviously, I'm going to lose a bit more weight, but if I do a tummy tuck, obviously I'm removing that weight right off the bat.
Chloe would like to know, in terms of pain and recovery time, do you recommend doing multiple procedures at once or breaking them up into different surgeries?
Makes no difference. Cost is the same, pain is the same. The only difference is the recovery time is double for 2 stages versus 1 stage, right? So that's the only difference. The other caveat is if you do it in 2 stages, you get a chance during the 2nd stage to adjust the 1st stage, right? So you can potentially tweak, do a little bit more lipo, little touch-ups. So that's the advantage of that.
Nat3 would like to know, what are your age maximum limits?
I don't have an age maximum limit. I think we've done a tummy tuck on a 78-year-old. They did just great. Health is the most important part, and being a good candidate for surgery is important, but age is not a rate-limiting factor.
Richard would like to know, do you accept payment plans?
We work with a couple of different third-party financing company, Care Credit, Alphion, and Patient Fi. Basically, you make payments to them, they give us the payment up front, minus some fee that they charge. That's how they make their money.
Carmen M. would like to know, how long after a consultation with you can the surgery be scheduled?
Well, if there's room on the schedule, you can book it at any time. You can book it out far in advance as well. We have some limitations on there, like booking it out, like I think a year or 2 out. There might be some restrictions on that because things might change price-wise with supplies and stuff, so we might have to retweak your quote. But you can book it as far out as you want, and realistically.
How far out are your surgeries at the moment?
Depends on the length of the procedure, right? So big, full day surgeries, I think we're booking into February. Shorter surgeries, 1, 2, 3 hour surgeries, we can always make some room here and there, before a case, after a case. On certain office days, we can also adjust it and make that into a partial surgery day. So short cases, more flexible. Bigger cases where it takes all day long, we're in the February-ish time frame.
Yeah. How far out are your consultations?
We usually try to do consultations about 2 weeks out. If they stay too long beyond that, I think there's some people get a little bit antsy about really having that conversation and making their plans. So I think we generally are in that 2 to 4 week time frame for most of our consultations. And
how can you go about setting up a consultation?
Well, in this day and age with technology, you can do that in a lot of different ways. You can do that through Instagram. You can message us there. Probably the best way to do that is go to our website, and there's a consultation button there, and then just click that, and that gets you into a portal, and you can put all sorts of different information in there. But you can always just pick up the phone and call the office. Our office phone number is 855-377-3782. We're on Mountain Standard Time. We're open from 8 to 4, I think most of the day, all the days. And so just pick up the phone, one of us will answer, and then that's probably the quickest way to do it.
Perfect. Well, thank you so much, Dr.
Thanks, guys.
Repta.
Appreciate it.